on the topic of the drugs and alcohol, should one stay away from TMS if they're suffering from those addictions?
I think not at all. I think that we know TMS is super helpful for the brain in terms of recovery.
Mhm.
I think it's just about approaching it wisely, right? Obviously, there's certain risks. So I was reading an interesting, an article just came out in JAMA about cannabis use disorder,
Okay.
and that there's a 3 times higher likelihood of death in the 5 years after somebody shows up in the ER with a diagnosis of CUD, cannabis use disorder, 10 times likely to die from suicide.
I didn't see that, but that's fascinating.
Yeah, I was blown away. I never would have thought the stats were that high.
Right.
But I think the idea is so we know those patients. We can identify those patients who are using substances, I think, as more of a self-medication to help with symptoms of depression, anxiety, and those who have that. I believe it's always dual a diagnosis, right?
Yes.
But you have the addiction and the ones that we feel like we really better get them more stability, like a community, like the tools before we would add the TMS. It's all about personalized care. So I've treated people that are literally, they're smoking marijuana every day, and they are very motivated, and they know if they were feeling better or less anxious or sleeping better, they would be able to stop. And I'm all about helping them with TMS. And it's a process, and you're tracking it throughout.
Of course.
Things like alcohol, we have to be careful, right? Just because seizure risk and lower. So I think those people, we sort of really want to make sure they're in a good program, that they have the ability to maintain a sobriety, that they have those resources. And then adding the TMS in terms of their just repair of the brain is incredibly advantageous.